I think one of the things that is most important is probably experience, okay? And experience in a good way. There's many surgeons that tell, oh, I've done 20,000 or 30,000, whatever the number is. And that's well and good. But many times they're not necessarily doing good surgery, okay? And that's not helpful. But an experienced surgeon that also believes in a paradigm of excellence. They're constantly, improving not only their technique, but they're advancing the field of medicine and making what we do every day better and safer for patients. So that's a rare person, rare surgeon in our society, and it's difficult to find them, but they're there. They're in every community, they're in every town, every city, and and they're typically the ones that have the greatest amount of experience, because like anything in life, the more you do, the more you learn. And having done this for over 25 years and 75,000 surgeries, some days I think, I've seen it all. There's nothing new that I'm going to see. And lo and behold, that week, sure, I'm going to see something that, wow, I've never seen that before. And so having the repertoire of experience helps me to know how to deal with that. Is it serious? Is it a problem? What do we do to care for it, to treat it? Really critical. So experience, but also that experience has got to be embedded in a paradigm of excellence. Just a relentless pursuit of excellence is really essential. And I think the third thing is really a passion for people. You can't be a technical robot, all right? You have to, in this business, you have to interact with people and know what makes them tick, what is going to make them happy. Not everybody's going to be happy with laser vision correction, and you have to understand enough about human nature, and you have to like people, all right? You're dealing with them, okay? I can't just sit here and do surgery and send my patients off to somebody else to deal with their problems. That's my responsibility as a surgeon. So I need to be, the kind of person who enjoys seeing people that are doing great, and also the people that might have a problem, and know how to empathize with them, how to understand where they're coming from, and make sure that they know that, look, this may be tough, but we're going to get you through it. We've seen this many times before, and we'll solve this problem. And that makes all the difference in the world. When you have an eye surgery or procedure, and maybe your eyes aren't seeing so well, all sorts of crazy things start going through your head. And seeing a surgeon who understands the frailties of humanity and knowing how to help you through that period, because you're going to get there, but it can seem kind of tough at the time. And these really aren't in any level of hierarchy necessarily. But I think the fourth thing is really having the respect of your colleagues and your peers. I teach at the major meetings, I have courses, I have surgeons who come and visit us, and sometimes I'm kind of astonished how little they know. Many of the basic things that, as a surgeon doing this for 25 years, seem like common sense, are just not even appreciated by maybe a new resident coming out of practice, or even a seasoned professional. I've had surgeons come here that work for LASIK chains, for example, that have done thousands of cases. And they get home, they send me a personalized card with a gift saying, thank you. You've given me so many insights into how to make my practice, my patients better. And so just being able to help make our practice, our profession better, and gaining that respect is important. So there are ways for a patient to find out, I think, that information, who in the community is respected, who teaches, who prepares papers, publishes papers, writes textbooks. I've written textbooks on refractive surgery. All those things are really important in terms of selecting a surgeon that's going to provide an excellent outcome for any patient.